Hi, it's Dr. Elisha Van Dusen at New Hope Chiropractic. Are you prone to headaches? And if so, you probably realize that performing normal everyday things is virtually impossible if you suffer from them on a consistent basis. And if severe enough, like a migraine, feels like relief is never going to happen. Maybe you've tried everything to manage your headaches, but have you ever tried a more holistic approach to find relief, such as chiropractic treatment with spinal adjusting, exercises, and stretches? Well, I know what you're thinking, but how do exercises have anything to do with chiropractic? And in actuality, it has everything to do with the spine's alignment and also the neck, too, alignment of the neck. According to the American Chiropractic Association, about 5% of all headaches are warning signals caused by disease, and the remaining 95% of headaches are primary headaches like tension, migraine, or cluster headaches. The greatest majority of primary headaches are associated with muscle tension in your neck. The chances of having a headache directly related to a neck problem are really quite high. And if you're still not convinced, well, let me go over some of the different types of headaches with you. There are tension headaches, and these are typically the most common. They're called episodic tension headaches as well, and they occur periodically, usually less than 15 days a month. And you could take over-the-counter pain medication for these, but that just masks the symptoms and the problems keep coming back. So again, better thing to do is to adjust the cause, get chiropractic care, and also work on stress management techniques as well. And chronic tension headaches, which occur more than 15 days a month, a low load adjustment technique can be used to relieve chronic tension headaches. This involves adjusting with sometimes with lighter force if there's a lot of pain. And this force is put on the gentle force is put on the neck joints. That allows for smoother movement of the cervical or neck vertebrae. Stretching is also great in order to prevent chronic tension headaches from getting too bad. And there's cervicogenic headaches. These are typically one-sided pain type headaches that beginning at the back of your head and then move over to the front, and then they're often accompanied by shoulder or arm pain too. It's believed that cervicogenic headaches came from an untreated underlying neck problem. It was triggered by a newer injury, and these headaches are less common, typically don't get better with medication or any medical intervention like that. For this reason, adjustments especially are important here and should be used for this type of headache as well. Spinal adjusting involves again adding a controlled force, specific force to specific joints in the spine that are locked up and that are out of place. And if there's a lot of pain, mobilization can also be used so that joints are moved very gently, very passively to improve movement and reduce pain. And then sometimes more forceful adjustment can be used after that once there's a little bit more movement and less inflammation. And then deep neck flexion exercises for cervicogenic headaches also involve actively flexing the muscles and joints with guidance and advice from a chiropractor. And then migraines, they differ from headaches in the way that they can bring on dizziness and nausea too. Also, people resort to medication and injections for relief here, but chiropractic is a more holistic option. Again, that gets to the root cause of the problem and it doesn't have the nasty side effects of the drug route. And also in some areas of the neck where there's a lot of sensitivity, there can be a little bit of pressure point work too, neuromuscular work that resolves the trigger points and the pressure, the knots in the back, neck, and shoulder, head region. And a combination of things can be used as well that's very effective. Chiropractic at the heart of it. Most important is neuromuscular soft tissue work, also some dietary counseling and relaxation techniques. All of these can help and greatly assist with getting rid of migraines. So whichever type of headache affects you, we'll be happy to get you back to feeling like yourself. Contact our office today to learn how we can get you started with an appropriate treatment plan and get rid of these headaches, help get rid of these headaches for you or a loved one or friend or family member. Check us out at newhopechiropractic.com and have a healthy day.